So something I found interesting, going on from another topic we talked about, where people who don't know what hypnosis is say that I don't think I can be hypnotised. But I would argue that they've actually been hypnotising themselves, and that self-hypnosis is what has caused or contributed to that problem.
Issue, yes.
Exactly. I mean, as an example, somebody who has a fear of dentists, or fear of dental injections. Say that they wake up one morning, they have a toothache.
Yeah.
Then immediately in their imagination they start thinking, oh, maybe I need to go to the dentist. And then exactly.
Got to go to the dentist. Oh, it fills me with fear. Oh my God, what's going to happen?
Yeah, they start playing little movies in their head.
They see movies in their head of like a dentist with this huge drill, like cartoon.
And you hear the noise and the vibration.
Yeah.
And those needles which don't look enormous.
Exactly.
And something messing around.
Yeah.
And they're playing this all in their head.
What's going to happen? What's going to happen? What if? Seeing the absolutely worst case scenario, and not even maybe the worst case scenario, an imagined crazy scenario.
Yes.
And that is negative self-hypnosis.
Yes.
So they're seeing what could possibly happen in a negative way.
That's right.
And they've proven they're very good at it.
But what do they actually do?
Avoid it.
Yeah, they avoid it. They think, I'll see if it goes away by itself.
That's too bad. I'm not going to do that.
I'll take some Angen or something like that.
Yes.
They take a painkiller and see if it goes away.
Yes.
So
they never know any different.
No. And if you sort of analyse that behaviour, I mean, that sounds sensible. You know, somebody's afraid of something, so you avoid it. Isn't that the point of fear, to stop you doing something? But in this case, the fear is obviously irrational because dentists.
Nobody likes going to the dentist. Let's face it, it's not something you think, great, I'm going to go to the dentist. It's
I hope I get filling today.
It's a little bit uncomfortable.
Yeah.
It's a little bit unpleasant.
But if you've got toothache, it's painful. If you've got toothache,
is painful, and toothache leads to tooth decay.
Yeah.
Which toothache I would think is one of the most awful things. It's like backache or earache. They're just horrible, horrible feelings.
Yeah.
And that's not going to go away without some intervention.
So, but if we analyse that behaviour, yes, they've avoided it, but they haven't quite avoided it because they've experienced that anxiety. They've been playing those movies and trying to predict, almost role playing themselves, going to the dentist and feeling anxious.
How long can I live this?
Yes.
Yeah.
So they've had all the anxiety and the fear without the actual real life experience of going there.
Because they have those physical sensations too, like you say. It's not just the thoughts. By thinking about the worst case scenario, their hearts may race.
Yeah.
They may feel a little bit short of breath. All those physical sensations that they could have if they were in the dentist, by imagining it in their mind, will absolutely bring on those sensations.
Absolutely, because for them it's real.
Exactly.
Which of course is also how hypnotherapy is working, because we have to imagine the opposite.
So that's right. So if we see somebody for therapy for the same scenario, dental phobia, it would be using their imagination to imagine the best possible or a sensible scenario that you're going to go to the dentist and it's going to be quite relaxed.
Yeah, I mean it's filling in the thing they've avoided, which is the real world experience.
Yes.
Which, first of all, by facing their fear, they can develop that kind of emotional muscle and coping skills to deal with it.
Yes.
Which in itself will reduce the anxiety.
Yeah.
They also lose the experience of going there and having the treatment and actually
thinking,
it wasn't as bad.
Yes.
I mean, I had years ago, I had my wisdom teeth taken out, and I remember for the 2 weeks before I had this, it was a hospital appointment because they were quite bad.
Yes.
And I was really anxious. And then I went in there and I had them done. And it wasn't a pleasant experience, I would say. It wasn't that unpleasant.
No.
And I can remember at the end of it reflecting, thinking, all that worry, all that anxiety for that.
Yes.
So people who continuously avoid that experience are missing that
and they have
realising that it's not actually that bad.
No, and they have constantly that worst case scenario within their mind because it's never, bashed to the ground by actually going through it.
Yeah, exactly. And they're missing is, and the best way to explain this is to do a demonstration, which we can do as well. Hold your thumb and your forefinger together. Now, as you touch, you feel the sensation of touch.
Yes.
But if you hold them together and don't change the pressure or move them at all, then that sensation will disappear. Because your brain on some level is saying, okay, I've got the message. I recognise that.
Yeah.
I don't need to keep telling you about it.
Yes.
It's a process called habituation. And you can imagine, if you were scared of, say the dentist, being in the dentist chair, can you imagine if you went to a dentist and you sat in the chair and you just lay there, feeling that anxiety, and nothing else happened?
Yeah, you just went through
what would happen? The anxiety would just decrease.
Subside.
In fact, if you did it long enough, I'm guessing you start to get bored.
Yeah.
And thinking, how much longer we can do
this?
Is
this it?
Yeah.
Yeah.
I mean, we get that in therapy. When we're doing desensitising someone's anxiety, our goal
again.
is, we're kind of going, I'm going to do it again.
I'm not bothered anymore.
No,
perfect.
I'm a bit
That's
bored.
the result.
Yes.
Yes.
So when we thought about this before, you were anxious, and now is it time to go? And that's a success.
Yeah, it's being desensitised.
Yeah.
Yeah.
So when treating anxieties and phobias, the approach we use is one that involves the client has to have a little bit of courage and face that anxiety.
Yes.
And we do it in a way where they remain, where it's safe.
Yeah.
They're in control.
Yes.
Because in the therapy room, using their imagination, they're in complete control.
Yes.
Whereas out there in the real world, they're not.
They don't feel they're in control.
No, don't feel they're in control. Yeah. And also because we're using hypnosis, they're profoundly relaxed.
Yes.
And it's difficult to impossible to be anxious
and relaxed
when you're all, exactly.